It's 8:30 here on the morning show, and we're going to learn about something today that might change your life, especially if you're dizzy, if you have dizziness problems, right?
Right.
This is very interesting. We talked a little off air about this. We got Sara Geen here. We're going to talk about vestibular therapy, and Tammy Prupp's here as well as backup. She's a good backup, right?
Backup. That's right.
All right, very good. So let's find out a little bit. Vestibular therapy. What is it?
So vestibular therapy is, when somebody complains of dizziness, they feel like their room is spinning when they move their head. They have a hard time focusing whenever they are in busy environments, say at the grocery store, they're in the car, and it can come on suddenly, or it can be spells that just come and go.
How common is this? Kind of curious how people have this.
I'd say about 40% of patients within your life are going to experience some sort of dizziness.
So what makes it happen? How do you end up with this?
So there's a couple different reasons or causes for the dizziness. I'd say the most common cause is going to be what's called BPPV, stands for benign paroxysmal positional vertigo, where you'll have crystals that fall out of place in your inner ear. And when they fall out of place, they move in one of the semicircular canals in your ear, and when your head moves in certain positions, you're going to complain of this sudden onset of a spinning sensation that may last a minute, and then when your head moves out of that position, it will go away.
For heaven's sake.
Okay, when you say crystals, what exactly is in your ears that would fall out?
So your vestibular system is made up of 3 semicircular canals that are filled with fluid, and then you have 2 organs within the vestibular system called your sacula and your
No, that's okay.
and your macula.
Okay.
And those calcium carbonate crystals, as you age, can either get a little looser, or
Okay.
they'll fall out of the canals and go into those canals and lay on the hair cells.
It's a fine-tuned thing your head is in
Right.
that area, and just a little bit can throw you off where things aren't right, aren't they?
Right.
Very interesting.
So what do we do to fix this?
So how you'll fix it is whenever you come to your physical therapy appointment, the therapist will do an eye exam. So they'll look at your eyes just to the naked eye, and then they'll also put some goggles on your head so that you can't see anything, but your eyes are going to show up on our computer, and your eyes are going to do an abnormal movement, which is called nystagmus, with certain tests. And we'll do some canal testing to test if it's the crystals that are out of place, and your eyes will go into a nystagmus where they'll all of a sudden beat really quick. And we're looking for that nystagmus as far as what direction those eyes are moving and what canal is causing the problem. And then the therapist will do some repositioning of the head to move those crystals around that C-shaped canal and place them back into the organs in the ear where they're supposed to be. Sometimes it will take 1 visit, sometimes it may take 5 or 6, but a lot of times it's very successful as far as putting those crystals back into place. We can also show the patient on how to do the repositioning maneuvers at home. It depends on what canal they're out of place in as far as what head maneuver you're going to do to correct it. But I'd say that's the most common reason that we see the dizziness. We will see patients for dizziness say they have an inflammation that attacks their vestibular nerve in their ear. They may have dizziness because of a concussion. They may have dizziness because they've had a stroke. They have Meniere's disease. It can be caused by diet. So there's various other reasons that therapy can treat their dizziness as well.
But the crystals moving are the main thing in that. Well, Tammy was telling me off the air beforehand about how amazing it is, even after sometimes 1 visit, that people come and they can't hardly even stand up. And after having the adjustments and stuff, they're good to go.
Mm-hmm. Yeah, it's a life-changing. It is a game changer. If you come in and you're dizzy and you've got a professional therapist that can correct you, it's like I said, it's life-changing.
That's right.
How often, let me ask a better question. Is this like people have had this for a week or a year or a lifetime or?
Generally, if it's the crystals out of place, so the BPPV that's causing the dizziness, they will be perfectly fine and say they just wake up one morning, they go to get out of bed and all of a sudden they have this spinning sensation and they're really dizzy, they may get nauseated and sick and they have no idea what's going on. So a lot of times they'll go to their doctor or to the ER because, they think they're having a stroke. And it's just these crystals that have fallen out of place. They didn't hit their head. It's just unfortunately part of an aging process that can cause these crystals to fall out of place.
Very interesting.
I think
I've never heard about this before.
Yeah.
It's something. How long have they been doing this kind of work?
I'd say, they've been really looking at vestibular problems for probably the last 30 years, but at St. Anthony's we've been doing it for about 10 years.
Okay.
And we have a couple therapists that have advanced certification in the vestibular. So we have the goggles that can really look at those eye movements and see what's going on with the ears.
Do you watch football?
A little bit.
Did you see Patrick Mahomes get whacked this weekend where his head hit the turf? And it didn't look like he hit the ground really hard, but when he got up, he couldn't stand up. He was dizzy. Mm-hmm. Is that maybe that those crystals got moved around in his head, even though he was a young person?
It could have been the crystals, but more likely it can be some sort of, blunt trauma to the head as far as concussion. And a lot of times, when we see patients with concussions, they're going to have a hard time focusing on objects when they move their head. So they're going to have a really bad motion sensitivity. So, lights are going to really bother them. If they go to the store or in the car, they're going to have to close their eyes because just that movement is going to cause that dizziness. So what therapy can do at that point is give them some eye exercises to improve that motion sensitivity and then actually have them do exercises repeatedly that decreases the sensitivity to that movement. So with that, it's more of a gradual progression and improvement, but therapy can definitely help that as well.
So, Sarah, what kind of training do people have at St. Anthony's to make them qualified to do this?
So we have two therapists that went down to Atlanta, Georgia about probably 7 or 8 years ago for a week-long certification course that had instructors from all over the country, and then they limit it to just a certain amount of professionals to attend that course. And we've had two therapists that have advanced training with that.
Very interesting.
It is. This is really something.
Yeah, this is good. And what's the youngest person you ever seen with the crystal problem? Kind of curious.
I'd probably say mid-20s.
Mid-20s even, huh?
Yep, we can have it that low. But a lot of them, are going to be, in their maybe 60s and on up.
Okay. And it just happens.
And it, just happens.
That?
Yeah.
All right. So if somebody's having that problem right now and they maybe just woke up with it this morning, what's the best course? What should they do first to get the ball rolling?
So they'll need an order from their medical provider, and then they can fax that order to St. Anthony's Hospital, either here in Effingham at the Workman Complex, or our clinic in Altamont has another therapist that's trained in it as well. We can, with certain insurances, see patients with just direct access, if that's approved with their insurance.
Once again, it's so cool that you don't even have to leave town to get this treatment.
Exactly.
I love it.
Very nice. All right. So once again, if you're feeling this problem, and you guys are online, you got all the information online for stuff like this as well. And
yes,
very good. So I think we all learned a little something today.
Well, I did.
Next time I'm dizzy, I'm going to figure it out.
Yep.
About every day.
And if we do have patients that call in that have this, we normally get them in that day.
Oh, awesome. Probably the quicker you get to it, the quicker you can get it taken care of.
Exactly, because they're not feeling well, so it's something that needs to be seen, as soon as possible.
Very quickly. Very nice. Well, ladies, pleasure to have you here. And Tammy, when are you coming back again?
I will be here Tuesday.
Oh, very good. We're looking forward to it. Okay. Thank you very much for coming in. We've everybody around has learned something new today for sure.
Absolutely.
Great.
Very good. Sara Geen and Tammy Prepst from HSHS St. Anthony's Memorial Hospital. Always a pleasure to learn something. It's a good day when you learn something.